The primary objective of the COVID-19 global response is to slow and stop transmission, find, isolate, and test every suspect case, and provide timely, appropriate care of patients with COVID-19. Screening can be performed in areas such as the emergency unit, outpatient department or primary care clinic, in the community by a community health worker, or by telemedicine, which we will be using for this video. Efficient triage and screening process should be done before clinic consultation. Select only patients who need urgent, thorough physical examination whose needs cannot be addressed by telemedicine.
So you have a total respect on your peers that you cannot remove. So okay, we need you to visit our clinic for the proper treatment, but first let our assistant screen you first.
Do you have fever or chills?
No.
How about cough?
None po.
Any trouble breathing?
No.
Sneezing or runny nose?
None.
Lastly, have you been in contact with anyone who has COVID-19?
No po.
Okay, we can assist you at our clinic. Can you come in at 2:30 today?
Yes po.
Actually, let's make it 20 minutes to 2, as the doctor needs to disinfect the treatment room in between patients.
Sure po.
So the doctor will see you after his current patient. But your friend will need to wait outside as we have to reduce the number of people in our treatment. Please take a seat here, sir.
Efficient triage and screening process should be done before clinic consultation. Select only patients who need urgent, thorough physical examination whose needs cannot be addressed by telemedicine.
Next patient, please. So good morning, I am Dr. Rahul. May I ask you a few questions before you start the interview? So may I know your name?
My name is Tandoori Kostupoda.
What's your age?
I am 22 years old.
Can you tell me your birthday?
It's 24th April 2000.
So for today I will assess your ear, and for me to do that I will have to ask your consent to touch it. Don't worry, all our procedure is the proper head hygiene and all our instruments are clean. So rest assured that all the information will be between us, it will not share, and it will be confidential. So okay, let's get started. So what you brought for the consultation?
Actually, there is cotton stuck in my right ear while cleaning the right ear with the earbud after taking a shower.
Okay. So let me check that better. But does it cause the pain?
No problem.
Okay. Do you note any discharge?
No problem.
Okay. So how about your hearing? Does it affect hearing?
Yes, problem. I think there is less hearing in my right ear.
Okay. Let's now proceed to the physical examination.
Yes, sir.
Follow these 5 steps every time you wash your hands. Wet your hands with clean running water, turn off the tap, and apply soap. Then lather your hands by rubbing them together with the soap. Lather the backs of your hands between your fingers and under your nails. Then scrub your hands for at least 20 seconds. Rinse your hands well under clean running water, then dry your hands using a clean towel or an air dryer. To ensure proper donning is accomplished, the physician must be able to ensure all supplies are available, perform hand hygiene before donning, remove all jewelry and accessories, secure long hair, and also wear PPE in sequence. In this picture, you can see a properly donned physician.
So now I am going to the physical examination of the ear. So is it okay if I proceed?
Yes.
First I will cut the ear. Slowly I will touch the ear. So I will just take for any information and listen. And it is dark and controlling of the ears.
I will be checking the data laptop. This is the scope. Category. So now we will be testing the auditory activity using the whisper voice test. So I will be standing behind the patient to read this test, and I will be asking the patient to read by closing one side of the ear. So can you close the ear like this? I will be saying 2 or 3 words. I will repeat them. Apple, orange, mango. Close the apple. 1, 2, 3.
Now I am going to perform the test using this tuning fork. I am going to place this tuning fork on the midline of the mid forehead of my patient, and I am going to test. Now I am going to perform the neck test using this tuning fork. I am going to ask the patient how she can hear the writing.
If there were other foreign body concerns, a plain radiograph is the primary imaging modality that will help detect and characterize the location, size, and number of the foreign bodies. To assist in the localization, 2 views, anteroposterior and lateral, are usually necessary. Now for the management, techniques, and complications. Several techniques are available for removal of a foreign body from the external ear. Selection of the technique depends on the shape, composition, and location of the foreign body and the canal. Sitting or semi-reclined position is used for irrigation, so water can flow out of the ear. This is also usually the preferred position for the suction and manual removal techniques, so that gravity is not working against the effort to remove the object. Complications. Injury to the external auditory canal is minimized with direct visualization using the operating microscope and proper instrumentation, as well as minimizing patient movement. Attempts to remove the foreign body may result in pushing it beyond the isthmus, causing edema, which can trap the object and make removal difficult. A foreign lying medial to the isthmus is difficult to remove without injuring the tympanic membrane and ossicular chain. The best chance for removal of a foreign body is the external auditory canal in the first attempt. When it fails, the ear may become extremely painful and proper anesthesia may be necessary. Doff PPE properly in the designated area. This is done by slowly and carefully removing each article so it does not contaminate the regular clothing. Remove the PPE in sequence which is shown in the video. You must handle the cap, mask, and goggles or shields only at the bands or earpieces. Hand hygiene is done in between each step, and the physician should also dispose and segregate used PPE in separate resealable bags according to reusability and disposability. If it is for reprocessing, then it should be first cleaned with a disinfectant, then follow proper reprocessing procedures.
We have successfully removed the cotton So there is a proper way of cleaning now your ears to prevent situations like this in the future. But please know that earwax serve as a protection and lubricant for your ears. They also work like a filter to keep things like dust and dust from entering your ears. So they are only bad for you when excessive earwax stands up and builds up and causes symptoms like our common hearing. You may develop ear infection and infection, but these rarely happen. We do not recommend using cotton pads to clean your ears. So however, you may use them to wipe this bit normally and create excess pads or get rid of excess water after spilling or taking a bath. So just be careful to stay on the outside of your ear. But if you feel like build up already, the best way is to consult your local audiologist and let them handle it for you. Do you feel better now?
Yes, I can hear better than now.
That's good. Do you have any other